Next, we have John Moore, CEO of Twine Health, sharing his perspective. Thanks, John.
Everyone, great to be here. Some of my favorite people around, very inspiring. For those of you who don't know, I'm a doc, but I left practicing medicine 10 years ago. I couldn't deal with the way we were delivering care. To me, it was just not where we needed to be. In fact, it was embarrassing. And it was before direct primary care was really taken off, and I was an ophthalmologist. But I would have made the shift, but it wasn't an option. So I went, having a technology background, into the area of how we could build technology to empower these really new and exciting new models of care. I want to give you a little reflection recently that to me was very impactful about the imperative of why we need to do this. So my company, Twine Health, we build a health activation platform that really allows patients to participate much more deeply in their care, to set goals and action plans and work with you on behavior change. And we're specifically equipped for folks that are doing health coaching in their practice, either themselves or their care teams. And when we started our business, we worked with both accountable care organizations and with people in direct care. A lot of people from ACOs were flocking to work with us because we had published a lot of papers, and we currently hold the largest impact hypertension and diabetes results in the world that we published with the Jocelyn and MGH. So we thought, this is great. These folks are taking on more risk-based contracts. They want to do value-based care. They're coming out of the woodwork to work with us. We have 0 customers left in value-based care. People got healthier. Really. And it sucked, right? It sucked for our business. It sucked for me personally, because we take a population of diabetics and get their hemoglobin A1C down, and they said, well, now we realize it's not really good for business. So it's an imperative. It's not just because the lifestyle of being part of that is contradictory with what we went into medicine for. Their business model and their approach to care is so messed up that even with this value-based care piece coming, this is what happens. And that is an atrocity. So it's an imperative that we do this. So that's why it's fun for me to be at these things. A little bit emotional sometimes, because I've dedicated the last 10 years of my life to this, and we succeed at getting people healthier, and it's not good enough for them, right? They want to preserve all those ER visits and hospitalizations. So here's to all of you that are doing the right thing. And I've spent a little bit of time telling you about what we do to try to help you do that even better. So Twine Health is really focused on how do we help patients participate at a way deeper level in their care. So what we do is build technology, we call it a health activation platform, that allows patients to share a lot more about where they're coming from, what their motivations are, what their current health status is, and then to be able to help you or other members of your care team create what we call action plans. These action plans are very crisp. It's what are we going to measure? What are we going to do differently? How many days a week? What time during the day? And they often get very specific, things like skip the potato chips. It's not eat healthier or run. It's very specific. What can you do? Maybe you eat too many breakfast sandwiches from McDonald's and skip the sausage that you have on that. Or maybe for him it's skipping the potato chips. But he also needs to do the medical aspects of his care, the taking the medication or also the exercise piece, making it very crisp and having him participate. So co-production is a huge part of what we try to help people do. Co-producing is hard because you've got people coming from different angles with different perspectives. We provide the tools that allow you to sit down and say, well, what's going to fit into your life? But from a medical perspective, what do I think you really need? And you can reach a compromise there that then synchronizes with the patient in their life, reminds them, but more important than reminding, it lets them experience. It lets them try something and see if it works. Try something else and see if it works. People learn not through reading long learning materials. You can't send them a patient up-to-date message with this big article to read and to synthesize. our work has studied the science behind how people learn and the health psychology behind it. People try things and learn, and they share it with other people, and they reflect on that, and they build new skills. Then you need the tools to be able to see who needs help and when. So we have a lot of artificial intelligence that sifts through all of this data so that you aren't just under this barrage of blood pressures and blood glucose and all of these other measurements, but help you see who in your panel is struggling with being adherent to their plan. And we track trends and which ways people are headed so that we can detect people before they fall off the rails, so you can be that superhero that is there right at the minute when they need it. And just like in the previous talk, timeliness is of the essence in healthcare. People will care way more about the 5 minutes that you spend with them right when they need it, rather than the hour that you spend 2 months too late. So really being able to sift through all that data and then communicate with them, the whole team being able to communicate on top of that plan and help them to succeed and help this fit into their daily life so that they're not in your office, so that they're out there in the world doing the things that they want to do and getting the convenience from this new kind of care that they get from you. The value that we provide is something that we've studied over the past decade. We have randomized controlled trials behind all of this, and have been able to show that this type of care reduces office visits by 2/3 and currently produces about 3 times the chronic disease outcome. So if the average patient in medical care in this country currently gets a 6-point drop in blood pressure in a year, we published a 26-point drop in blood pressure in 3 months. And part of that is you, but part of that is the patient. Right now they have tools. We released a recent release where patients can actually create and update their own plans before you even have the chance to talk to them about it. Just imagine that your patient comes to you and said, well, I set this blood pressure goal, and I've decided I'm going to cut this out of my diet. What do you think I should do on top of that? Instead of you having to start from scratch and trying to sort out that motivation, we build a lot of the tools to assess that motivation and help get them started. And that really gets people moving towards these outcomes. As I mentioned, we've also published the largest impact diabetes results in the world, a 3.2 drop in hemoglobin A1C. We didn't do it. The patients and these next generation of providers who are interacting, co-producing plans of care, and then working together in this much more fluid model just yields amazing outcomes. And just so happens that if you're in a direct care model, that means better for your business, right? Because fewer office visits, but happier people and healthier people means that you can spread the wealth, the care to many more people, which is what we're going to need for this movement to really succeed. And we work with other folks in the space. We've been a long-time partner of Hank. Also releasing an integration with Twine Health in the coming weeks. And we also work with another company called Redox, probably not as pertinent to you guys, but if you're on some other EMRs that are more legacy, it's an integration engine to connect our tool with those EMRs. And think of us when you're thinking about scaling your DPC practice. You're starting to get to 300 or 400 patients. They really love the touch that you're having with people, but how do you get to that next level? Because there's really a lot of communication. We're really experts in health coaching, how you might bring on some health coaches in your practice and use a tool like this to expand. Most of our business is with folks who contract with self-insured employers who have a dozen practices or 30 practices. So we know what kind of numbers employers want to see and how you want to communicate. We built a whole intervention-based analytics platform that will show just how powerful direct primary care is, and so that you can bond together and bring all your results together and just embarrass the pants off of these jokers who don't want to change and take care of people. Thanks a lot for all your hard work, and thanks for having me.